I'm Melissa James. I'm a radiation oncologist and a member of the Royal Australian New Zealand College of Radiologists. A radiation oncologist is a specialist medical doctor who's trained to use radiation therapy to treat cancer and also to help with symptoms. About 1 in 2 cancer patients would benefit from a course of radiation therapy at some time in their cancer journey. Sadly, in New Zealand, we don't make 1 in 2. In fact, it's more like 1 in 3 patients. And in some areas of New Zealand, it's 1 in 4. So a lot of patients are actually missing out on radiation therapy that may be beneficial for them. We've seen an increasing shortage of medical professionals who are able to deliver and prescribe radiation therapy, and also a lack of radiation machines. Another problem we have in New Zealand is that patients often live a long way away from a radiation centre, and we know that travelling long distances is a disincentive for undergoing radiation therapy. In the recent workforce survey in 2019, we had 64 radiation oncologists in New Zealand, but our modelling predicts that in 10 years' time, in 2029, we'll only have 58 radiation oncologists. We also know from that survey that somewhere between a third to a half of radiation oncologists are wishing to retire in the next 10 to 15 years. We also have the challenge that with better conditions often offered abroad, we often lose our trainees to international centres. So what effectively that means is that as cancer incidence increases, there's going to be more work, but less radiation oncologists to actually do that work. The New Zealand branch of radiation oncologists have been working with the government to understand the workforce shortage, and we are requesting government funding to actually create more training posts so that we can supply the radiation oncologists we need for the future. We also need to increase access by building centres close to where the population is so that there's ready access for radiation therapy so that we can ensure equitable access across the whole country. We're also aware that it takes many years to build a radiation oncology machine and the supporting building around it, and also many years to train radiation oncologists. And we have deficits now, so we're impressing on government that the action is needed urgently.